Good morning, everyone, and welcome to Medicare 101. My name is Angela, and I am the library assistant at the Merrimack Public Library. This program is being recorded for later viewing. Please post any questions you have in the chat as they come up. Presenting our program today is Michelle Magarian of Hillsborough County ServiceLink. Michelle is a certified state health insurance assistance counselor and holds a certification for Community Resource Specialist on Aging and Disabilities. Welcome, Michelle.
Thank you for having me. So thank you for attending this presentation, Medicare 101. Again, my name is Michelle Magarian, and I am the Medicare coordinator for our Hillsborough County ServiceLink office. The ServiceLink office is located in Manchester at 555 Auburn Street. And we also have one located at the Nashua Senior Center at 70 Temple Street. So there's two locations for our Hillsborough County office. We are a free and confidential service. We are available Monday through Friday from 8:30 to 4:30. Yes, we do answer the phones live. It's not push 1 for English and 2 for Spanish, and hold on for the music. We do have to give individuals a call back within 48 hours per contract rules, unless you call us on a Friday, obviously, because we're not open on the weekends, but we will give you a call back at our next business day. So just to give you an idea of that. So welcome. This is Medicare 101. I'm going to give you a kind of a short synopsis of what ServiceLink is, and then we'll go into the Medicare piece of the component. So what is ServiceLink? ServiceLink was established in 2000. We have 13 administered community-based resource centers throughout the state of New Hampshire. ServiceLink is specific to New Hampshire. We are New Hampshire's ADRC, which is the Aging and Disability Resource Center. We were actually the first in the nation to adopt the ADRC model in 2006 was when we started that. In 2003, we built a partnership with UNH and the Bureau of Elderly and Adult Services to be able to collaborate with both of the agencies. Our monies come in through the federal government, through CMS, down to the Bureau of Elderly and Adult Services, to the local ServiceLink offices. Here at our Hillsborough County office, Easter Seals is our fiscal agent, but every ServiceLink office has their own fiscal agent, so therefore they're housed at a different location. If you were to contact ServiceLink at our 1-800 number, it would truncate you to your local ServiceLink office. So in this particular case, if you were in Merrimack, the probability would go that you would go to our Nashua office. If you have a Manchester exchange, then you would come to our Manchester office. So it really depends on where your exchange is and things of that nature. Again, we are a toll-free confidential service. We help individuals on a one-on-one counseling basis. Right now, unfortunately, due to COVID, we are not seeing individuals face-to-face. Because we are not all 100% vaccinated. We're in the process of getting vaccinated. We had to wait for our turn for our age groups because we did not have any type of seniority about getting vaccinated. So we had to wait to our age bracket groups. Again, we do work with the Bureau of Elderly and Adult Services. So we work closely with the Department of Health and Human Services, Bureau of Elderly and Adult Services, APS, the Adult Protective Services, social workers, and CFI case managers. Who works at ServiceLink? We have a center manager, and our center manager, her name is Mary Shonley. We have options counselors in both of our offices. In Manchester, we have Joanna McCormick, and in Nashville, we have Cassidy Donahue. We have a caregiver specialist. Her name is Amber McAnallen. We have two Medicare Specialist, myself, Michelle Magarian, in our Manchester office, and Lisa works in our Nashua office. So what does our options counselor do? Our options counselor helps individuals to navigate the complexities of the Medicaid system, and also options about community supports, things that you're maybe moving mom or dad from New Hampshire to another state, or from another state back to New Hampshire. How does that work? What do we do? Nursing homes. Is there any nursing home in the community that is currently accepting? Unfortunately, we do not have a listing of facilities that accept. It's a matter of finding the facility, and then if you have funds, pay for your benefits until you have spent down to the allowable amount to be able to qualify for Medicaid. There's a program that if an individual who's currently in a nursing home potentially doesn't feel that he or she should be there, and they would like to go back to the community, the options counselor would speak with him or her and the family and the nursing home staff about the possible safe discharge back into the community. Our caregiver specialist, she helps individuals with caregiver supports, the caregiver respite grant. There's also a grandparent respite grant, because a lot of our grandparents today are tending to their grandchildren for whatever reasons. If a parent has lost custody of their child, then oftentimes grandparents take over. There are also several virtual caregiver support groups that they could be able to assist you and help you to get to. So then again, we have our Medicare Specialist. My name is Michelle Magarian. I've been doing Medicare counseling for 19 years. I started as an intern in college, and I've always worked with seniors and adults with disabilities. Prior to going into college, I was an adult student, and someone came into the college and said, we're looking for someone for an intern to learn about Medicare and to help people to understand Medicare. And I said, I'll give it a shot. So 18 years later, I'm still giving it a shot. People say, how can you do this? And I find it very exciting and intriguing. I get to meet new people. I get to help people. Medicare never is the same from day to day. So it's always interesting and exciting, and it gives me great pleasure to come to work. I have been with this contract at ServiceLink for 14 years. So I've been here for quite some time. I was with the previous contract prior to that. So again, I've been doing it for 18 years. Medicare has many components. They have the Medicare Part A and Part B, which is what they refer to as original Medicare. They have the Medicare Part D, which is your prescription drug plan. They have supplement programs. They also have Medicare Advantage plans, which are also known as Medicare Part C. So with Medicare, they don't give anything one name is what I determined. So they like to keep us on our toes and keep us dancing. So that's what usually will happen. So when I'm saying things, oftentimes things will have more than one word. What I'm going to do is at the end of every segment, I will pause for any questions. So like Angela had said, if you have any questions, put them in the chat box. We'll answer the questions, but if as it goes through, I will pause so you have an opportunity to ask any particular question you have at that time. So at ServiceLink, we are the State Health Insurance Assistance Program. If you already have Medicare, or your mom or your dad or someone does, and you have what they refer to as the Medicare and You book, on the back of the Medicare and You book, if you turn it over, it shows you our 1-800 number. So sometimes we get like, you're the fifth or sixth person that I have called, and I'll say, well, do you have the Medicare book? And they're like, yeah, it's right here. I'm like, well, then turn it over, because the next time I will be the first one that you call, because our number is right on the back of the book. We are not licensed insurance agents. We are certified counselors through CMS, the Center of Medicare and Medicaid Services, to be able to provide individual non-biased information regarding all of the plans that are particularly available through the Medicare umbrella. So unfortunately, I cannot tell you what to take. I cannot direct you what to take. I have had many people along my tenure that have said, well, if you just point me in the direction, just point to the plan on the paper and tell me if that's the one I'm supposed to take. Unfortunately, I cannot do that. Again, the law prohibits me from saying what is covered and what is not covered, and what plan that you should take for yourself. And oftentimes what I will hear is that why does Medicare have to be so complicated? That why do we have to have so many choices? Again, throughout life, it's funny how when they give us choices, we don't like to have choices. And when they don't give us choices, we don't like the fact they don't give us choices. So when it comes to Medicare, they give us lots of choices to choose from. And sometimes it can be overwhelming and definitely cumbersome. If you're turning 65, your mailbox on a daily basis gets filled with lots of mail. Because there's lots of carriers, there's lots of plans. So if, for instance, United Healthcare, AARP, they have a Medicare Advantage plan, they have a Medicare Supplement insurance, they have a Medicare Part D plan. So just one particular day in your mail, you could have 3 packets that go over all 3 of those different programs, because they don't put it in the same stuff because they're all different departments. So they sell different plans. So just one carrier alone could just give you 3 packets of information. So sometimes that can be a little overwhelming for individuals. So what we try to do is make it less confusing, less cumbersome, and so therefore you can make a better choice for yourself. This is what they refer to as original Medicare. So this is what your Medicare card would look like. It would have your name, a Medicare identifying number, your Part A and Part B effective dates. You will notice that on the card now it has a random number letter combination that you have been assigned. They used to have it where your Medicare number was your Social Security number followed by a letter, but they have gotten rid of that because due to fraud and abuse and the security reasons. So now no longer you will have your Social Security number. This particular card you can laminate because the card is paper. So when you get it in the mail, you're not going to get a plastic one in the future. It will always continue to be paper. So yes, you can laminate it now. They took off the signature line of your Medicare card, because anything that has a signature line, you're not supposed to laminate it. So like they tell you not to laminate your Social Security card because it does have a signature line on it. So you're not supposed to laminate anything that has a signature line, but they did take the signature line off the Medicare. In order to enroll with the Medicare program, that is all done through the Social Security Administration. So the Social Security Administration administers the Part A and Part B benefit of your Medicare, and that is it. They do not work with the Part D Medicare Advantage supplement. They just implement the Part A and Part B of your original Medicare. Medicare is run by the federal government. It provides both Medicare Part A and Part B coverage. It gives you the opportunity to go to any doctors, any hospitals that accept the Medicare program. So if you have what they refer to as original Medicare, you're able to go to any provider that does accept the Medicare program. Sometimes they might not accept Medicare's assignment, but they would accept Medicare. What that means is that they do not accept the allowable amount that what Medicare has to pay for a plan. So therefore, you could potentially be balance billed if they do not accept Medicare's assignment. Very infrequently today do we find providers that do not accept Medicare's assignment, because most billing is done through the hospitals, and the hospitals themselves do accept the Medicare's assignments. So when are you eligible to enroll with the Medicare Part A and Part B? So when it comes to Medicare Part A, you as long as you have worked your 40 quarters, there would be no premium for the Medicare Part A benefit. If you did not work your 40 quarters, then the premium would be assessed off of the amount of quarters that you did work. So if you only worked 5 quarters in your life, then the premium would be accordingly to that. If you're drawing off of your spouse's benefits, then as long as they have worked enough quarters, you can draw off of them if they are eligible for their benefit. Medicare allows you to enroll with your Medicare benefits. What they refer to as the initial enrollment period. The initial enrollment period is 3 months prior to your 65th birthday, the month of, and 3 months after is when you have an opportunity to enroll. Unless you're already receiving a Social Security benefit, the Social Security Administration doesn't know that you're turning 65. So it is your responsibility to either contact your local Social Security office or to go on ssa.gov to enroll with your Medicare plan at that particular time. Medicare Part B does have a premium assessed depending on your gross income. Social Security makes the determination of what your gross income is off of the taxes that you filed from 2 years ago. So as of today, they would be looking at your 2019 taxes is what would determine on what your Medicare Part B premium is. The standard Medicare Part B premium right now is $148.50. If you are receiving a Social Security payment, it comes directly out of your Social Security check. If you are not receiving a Social Security check, then they will bill you quarterly for your Medicare Part B premium. If either yourself or your spouse is still working and you have what they refer to as viable coverage, then you're able to decline a Medicare Part B without any penalty. That's one of the questions that I get frequently is that some people might be 65, but their full retirement age is not till 66 and a half, and so they're going to continue to work because they don't want to retire at 65. And they want to know, are they going to get any penalty? The answer is no, there is no penalty for your not taking Medicare Part B. The rule of thumb is that if you work for an employer that has more than 20 employees, then you can decline the Medicare Part B without any penalty. If it's less than 20 employees, then it's up to the employer's discretion on whether they will allow you to continue with their employer-based plan or not, would determine on who pays first when it comes to the your plan. So if it's 20 or more employees, then Medicare would be your secondary insurance. Your employer's plan would stay first. So people will ask, well, what is the benefit for me to switch from Medicare, from my employer plan to Medicare? And oftentimes it comes down to the cost of the plan. So how much you're paying for your plan through your employer, how the coverage is. Do you have a high deductible? What is your copay amounts? Things of that nature versus what Medicare's premiums are and what your potential cost would be out for both of the programs. So that's where it comes down to, should you stay with your employer's plan, go to Medicare, or what you would like to do. One question that I get frequently is, what happens if I have an HSA account? If you have an HSA account, you would need to stop contributing to your HSA account 6 months prior to taking Medicare, period. You cannot take Medicare Part A or Part B and still contribute to your HSA account. So you would want to decline both Medicare Part A and Part B if you have an HSA account. If you do not have an HSA account, then oftentimes people will take the Medicare Part A if they have worked their 40 quarters and decline the Medicare Part B until they do need it. So what's important to always remember is the term viable coverage. So as long as you have viable coverage, meaning active employment either through yourself or your significant other, then you can decline the Medicare Part B without no penalty. So Medicare Part A is your hospital benefit, everything that happens on an inpatient basis. Again, you can enroll with your Medicare 6 months prior to your 65th birthday, the month of, and 3 months after. Or if you are disabled, it would begin on the 25th month of your disability determination at the Social Security Administration. So 24 months of disability, the 25th month, you're then automatically eligible for your Medicare benefits. Your Medicare Part A covers everything that happens on an inpatient basis. So hospitalizations, hospice care, skilled nursing, things of that nature. It does not cover things such as long-term care. So nursing home placement is not covered by the Medicare piece. In regards to the room and board of the Medicaid, of the nursing home, it would only cover the medical piece of the nursing home, not the room and board piece. And that's where individuals would either be private pay or they would go on Medicaid. You do not pay for a monthly premium if you or your spouse have worked your 40 quarters, and either you're drawing off yourself or you're drawing off your spouse's benefit. If you're 65 and your spouse is only 62, unfortunately, you would have to wait till he or she would be eligible for their Medicare benefit and be drawing off of that in order to qualify to draw off of them as well. So under Medicare Part A, there is a deductible. The deductible with Medicare Part A is a benefit period. So every 60 days, that Medicare Part A deductible renews itself. So if only you have what they refer to as the original Medicare, the Part A and Part B, and you have nothing else, not a supplement, not a Medicare Advantage plan, you're just going to have the A and the B benefit, then you would be responsible for the deductible for that benefit period. So the deductible is $1,484. And so if I just give you an example, if you went into the hospital today, you got out in the hospital on Saturday, you went back in to the hospital 20 days later, you would still be under that deductible period. If you went back into the hospital 70 days later, you would have a new deductible period. So if you went into the hospital, again, if I go back to that you went in today, and then you got out on Saturday, so that's 3 days, and you go back in that 20 days, you're going to start at day 4 for your hospitalization. So you'll see that the first 60 days is that $1,484. Then day 61 through 90 is $370 per day. Day 91 through 150 is $742 a day. And then you only have a lifetime reserve of 150 days of being hospitalized. In today's world, we do not see a lot of individuals who ever make it to 150 days, because they don't keep you in the hospital more than maybe 1 or 2 days unless you are really, really, really sick. The skilled nursing benefit is covered by your Part A. Medicare says that you have to, the first 20 days is covered 100%. Day 21 through 100 is $185.50 per day after that. So if you were in a skilled rehab center for 40 days, the first 20 days would be free. Day 21 through 40 would be $185.50. Plus you would have that $1,484. The way that Medicare is set up today is that you must be in the hospital for 3 qualifying days in order for your skilled nursing benefit to be covered under the original Medicare. The rules are different when it comes to Medicare Advantage plans versus the original Medicare. So 3 qualifying days. So it's really, really important today that we ask the provider, if you go, for instance, go into the emergency room and they're telling you that they're going to move you up to a unit In the in the past, it's always been that if they were moving you up to a unit, you were potentially being admitted. Well, not today. You can't just assume that you're being admitted. It's important that you ask, is this admission or is this observation? Because admission falls under your A benefit, observation falls under your B benefit, and you must have 3 qualifying days in order for it to be your skilled benefit to be covered. That means 3 qualifying admitted days, not the observation. Sorry, not the observations. Those do not count. So it's important that you ask that particular question. It also covers your hospice benefit as well. Then there is Medicare Part B. That covers everything that happens on an outpatient basis. So doctor visits, lab work, physical therapy, anything of that nature. Medicare, you pay a annual deductible for the Medicare Part B. That annual deductible is $203 per year. So the difference between Part A and Part B is that with Part A, they have a benefit period. With Medicare Part B, they have an annual deductible. So it's one time, $203. Then Medicare pays 80%, you pay 20% of Medicare's approved rates. The average cost for Medicare is $148.50. But if you'll see on the chart below that if anything if your income is higher than the standard, so if you're an individual and your income is more than $88,000, then you would pay a higher premium for your Medicare Part B, also for your Medicare Part D, which is your drug benefit. So depending on what your income is would determine on what your premium is. The standard individual does pay the $148.50. Again, it is removed from your Social Security check. Unless you are not receiving a Social Security check, then you are billed quarterly. There is financial assistance with paying the Medicare Part B premium. That particular program is called the Medicare Savings Program, also known to some as QIMBY or SLIMBY. So with QIMBY will pay your Medicare Part A and Part B premium, also pays co-payments, co-insurance, and deductibles. With SLIMBY, there's 2 programs with SLIMBY. There's SLIMBY 120 and SLIMBY 135. With SLIMBY 120, it only pays your Medicare premium. With SLIMBY 135, it only pays your Medicare premium as well, but you cannot have Medicaid and have SLIMBY 135. So you would have to decide whether you wanted to have your Medicaid or you wanted the financial assistance with your Medicare Part B premium. Oftentimes when people are referring to the Medicare Savings Program, they will just refer to it as QIMBY, period. They don't, and so it can be a little confusing because depending on what your income is and what your assets are, could determine on what particular program that you would qualify for. So not everybody qualifies for QIMBY, but they do. Most people just say, oh, we'll call ServiceLink and tell them that you're looking for QIMBY. So just, I always like to put that out there. There is 2 different programs, QIMBY or SLIMBY. One pays the premium, co-pays, co-insurance, and deductible, and one just strictly pays the Medicare Part B premium. So I'm going to pause at this point is if there's any questions. If not, then I will keep going. So if there's no questions, then I will keep going. So then there is the Medicare Part D, which is the prescription portion of the Medicare component. That as well, you can enroll 3 months prior to your 65th birthday, the month of, and 3 months after. So that is all follows the kind of the same rules of Medicare in regards to the initial enrollment period. With Medicare Part D, there is what they refer to as the annual enrollment period, which is October 15th to December 7th. So every year you have an opportunity to review your plan to make sure that indeed that is the best plan for you. Because on a yearly basis, plans come and go, premiums go up and down, medications come on and off the formulary. So even though you might love your plan, it costs you nothing to do a comparison. So you can either contact us and we'd be more than happy to do a comparison for you, or we retrieve the information from Medicare.gov. So you could go on Medicare.gov, create yourself an account on there, input your medications if you haven't done so already, and look to see what might be some different plans available. Sometimes what will happen is an individual will call us to have us just even look at their plan options. So they'll just say, hey, thank you. Here's my username, here's my password. Can you just help me understand this? And the answer is yes. We can log into the Medicare.gov site, go over the plan options, and so it helped you to understand, like, how's it going to be structured? What does it look like? What's my copays? What's, the deductible? There is a program as well to qualify for what they refer to as extra help, also known as low income subsidy assistance, which they refer to as LIS. And that would be where you can get some financial help to pay your Medicare Part D premium, also have a reduced cost of your copays for your prescriptions. If you have lost your employer plan, they do give you 63 days to get a plan in place without any penalty. So what I referred to earlier is that Part B has a penalty if you do not take the Part B. That penalty is a 10% penalty for every year you do not have a plan in place. Then you'd be able to enroll during the general enrollment period, which is January to March, and it wouldn't go into effect until July of that year. The penalties are not one-time penalties. The penalties are penalties for the rest of your life, unfortunately. Unless you are under the age of 65, then it all renews itself when you do turn 65, so you would lose any type of penalties that you had prior to that. But if you're 65 and older and you do not enroll during the necessary time, then you would acquire a penalty. When it comes to Part D, it's a 1% penalty for every month you do not have a plan in place. And you would be able to enroll during the annual enrollment period to get a plan, not at any time. So if you all of a sudden in like July came down with an illness and now you wanted to get a prescription drug plan, unless you qualify for the extra help or that you are on Medicaid, you cannot just enroll with a Medicare Part D plan because now you have medications. You would have to wait until the annual enrollment period, and then it wouldn't go into effect until January. So I always try to tell people when they are, they'll call and they'll say, I don't take any medications, so why do I need to take a plan? Well, you don't have to. No one's going to tell you that you have to, but you have to understand that there is a penalty. And that if you do need something in the future before the annual enrollment comes up, then you would have to pay for that cost of that medication fully out of your own pocket, or try to get assistance elsewhere through some of the financial programs for prescription assistance. When it comes to Medicare Part D, there is a premium. Most of the time, there is a yearly deductible. There's co-payments for your prescriptions. There's also what they refer to as the coverage gap. These are all of the plans that are currently available right now in the state of New Hampshire for Medicare Part D. You will see that the cheapest plan is $7.10, which is on page 2. So if an individual doesn't takes medications or doesn't take any medications and they're going to be new to Medicare, oftentimes they will take that particular plan. And if they needed it in the needed to change in the future, again, you can change to a different plan on a yearly basis. So you're not locked into that plan for the rest of your life. So that is kind of a good component when it comes to the Medicare Part D. During the annual enrollment period, again, your mailbox will be inundated with all information regarding Medicare Advantage plans and also Medicare Part D plans. If you do qualify for low-income assistance, LIS, extra help, whatever you want to refer to it as, there is an income program and an asset-based that they look at to determine on what your level of subsidy could be. So you could get 100% subsidy, 50, 75%, 50%, 25%, depending on what your income is and what your assets are. So there is some financial assistance. Sometimes people, when it comes to B and D, they'll say, well, I'm not going to take it because I can't afford it. But there is financial assistance for both of those programs, as I had discussed with the Part B. And then there is also the financial assistance when it comes to the Part D as well. So that's always a good thing. And what sometimes happens with our clients is that if they are currently on Medicaid and now they're going to be transitioning to Medicare, they're auto-enrolled into a plan, or they are they didn't even know that they were on Medicare Part A or Part B, and now they're being told that they have a prescription drug plan or they need to get a prescription drug plan, and they're going to have copays. Unfortunately, when it comes to if you were what they refer to as a dual eligible, being Medicare and Medicaid, you do have to take Medicare Part D. You cannot continue to keep your prescriptions covered by the Medicaid program. You only have to have A to have a D plan. So even if you decline the B and you just said, well, I'm just going to decline the B, you still would have to have a D plan. And most of the time, individuals are auto-enrolled into it. What I say for people who are auto-enrolled into a plan, they don't know what you're on for prescriptions. It's kind of a selection that they just say, this is the plan that you're going to get. So it's your responsibility to indeed make sure that your medications are going to be covered by that particular plan. So again, I would refer you to Medicare.gov if you have a computer. If you do not have a computer, you can either give us a call. We'd be more than happy to set you up an account, look at your options, or you can call 1-800-Medicare and they can do the same thing as well. So then they have Medigap, also known as supplement insurance. So supplement insurance is private carriers that provide gap insurance to your original Medicare. So the Part A and Part B of your Medicare options. There in New Hampshire, we have what they refer to as the letters. We have letters A through N. There are a couple letters that are definitely missing. Plan C and Plan F are only available to individuals if you were eligible for your Medicare Part A and you took your Medicare Part A prior to January 1st, 2020. If you did not, Plan C and Plan F are no longer options for individuals. They did away with Plan C and Plan F. So you would not be able to shop that if you were not eligible prior to January 1st, 2020. With Medicare, they have different components. They have Medicare Part, they have the plans A, B, D, G, K, L, M, and N. You'll see that definitely some letters are missing. They did away again with C and F. In 2006, when Medicare Part D came into existence, they used to have plans H, I, and J, but they had drug components attached with them. So they did away with those particular plans because once Part D came into existence, there was no more need for to have a prescription drug rider attached with the particular plan. Every plan has certain things that they cover. So at this particular time, the most comprehensive plan that covers most benefits is your G plan. The G, the only thing that does not cover is the Medicare Part B deductible, which is the $203. After that, everything would be covered 100%. So here at ServiceLink, we provide individuals the information regarding the cost of the plans. So if you are 65, if you are 70, whatever that you are, you would give us a call. We could send you a printout of what it would be for your particular age. Or you do have an opportunity to go on to the New Hampshire Insurance Department website and look at the information on there. Because they are private carriers, all their information is monitored and mandated by our New Hampshire Insurance Department. So they are the ones that do the negotiations of all the premiums. And people will often ask me questions like, well, why is one plan, $150 a month and another plan is $350 a month? Do I get something different? Do I get something better? And the answer is no. So if you went with plan N is plan N, no matter if you went with, one plan that's 150 or the other plan that's 300, the main components of the plan are the same. Some of them do have a couple like little bells or whistles, like husband and wife discounts, maybe potential low cost gym memberships, things of that nature. But we don't get into those specifics here at ServiceLink. We get into only what is covered under the Medicare piece of what's going to cover you in regards to your coverage. When it comes to supplement insurance, within the first 6 months of eligibility to your Medicare, can they not look at any pre-existing conditions? Unfortunately, Medicare beneficiaries are not protected by the pre-existing condition clauses for the Medicare that was put into existence with the Affordable Care Act in 2011. Medicare beneficiaries were not protected against that. So only within the first 6 months of eligibility to your Medicare can they not look at pre-existing conditions. Once you're beyond that 6-month window, you're then subject to medical underwriting, and they can say yes or no, whether they will cover you, or if they say yes, your premium could be adjusted accordingly to whatever your particular illness is. Or there could be a wait time between when you sign up for your policy and when the policy is going to start. So I always tell individuals when they're looking at supplement plans to think long and hard about what they want to take. Because even if you decided to take a less cost plan today, and maybe 5 years later, you say, oh, I maybe need something a little bit more comprehensive or a little bit more coverage, and you even want to change within the same carrier, you're rewriting a new policy. Again, you could potentially be subject to that medical underwriting, and also the premium would be at the age that you're coming into that policy now. So if you're now 70, you would be rewriting a policy at the 70 age category, not what you were paying if it just went up according to cost of living. Supplement plans do change yearly. It's not a fixed cost for the rest of your life. There is an adjustment according to cost of living. So the premiums do usually go up on a yearly basis. So the next component is the Medicare Part C, which is Medicare Advantage plans. So when it comes to Medicare Advantage plans, they're offered by private companies that are approved by CMS, and they provide your Part A and Part B services, and most of them do cover the Medicare Part D component of it as well. They also do have, some of them will have some additional services, maybe transportation, maybe dental, vision, hearing, where original Medicare does not cover any of those particular components at this particular time. So when it comes to Medicare Advantage plans, again, the initial enrollment period is the 3 months prior to your 65th birthday, the month of, and 3 months after, so that 7-month window. You can look at plans during the annual enrollment period, the October 15th to December 7th, for the plan to go into effect for January 1st, as long as it has a drug component attached with it. If it does not, then you would have to wait to the open enrollment period, which is the January 1st to March 31st. So they, as I just said, they use one is called an annual enrollment period, October 15th to December 7th. And then they have the open enrollment, which is a January 1st to March 31st. So during the open enrollment period, if an individual maybe signed up for a plan that their provider, they found out later that their provider didn't accept that particular plan, then they would have that opportunity during that time to switch to another Medicare Advantage plan or to go back to original Medicare and pick up a prescription drug plan. So only during the annual enrollment period can you come on to an Medicare Advantage plan and make changes from Advantage plan to Advantage plan. But during the open enrollment period you can only switch within the plans or go back to original Medicare. You cannot come on to a plan during that open enrollment period. So here at ServiceLink, we're not only the SHIP, the State Health Insurance Assistance Program, we are also known as the SMP, the Senior Medicare Patrol. So we help individuals to make sure that they don't, there's no scams, that if they get bills, for instance, that they don't feel that they should have a bill for a particular reason, or they were, a few years back, we were getting a lot of individuals who were getting durable medical equipment shipped to them, like back braces, knee braces. It's very important because what was happening is that they would call people and they would say, Mary Smith, and you would say, yes. Well, you just gave them permission to send you that item. So it's very, very tricky in regards to that. So, we always encourage individuals to not answer the phone, and when they ask your name, say yes. And I know it's easy to do. I've caught myself a couple of times doing that, and then I'm like, oh, I tell my clients not to do that. Why'd you just do that? So fortunately, it's not happened to me, but definitely some people a few years back, they were getting those durable medical equipment. And so it became a little cumbersome. Also, to make sure that you review your Medicare summary notice on you get your Medicare summary notice on a quarterly basis. Also, if you have a Medicare Advantage plan, you get an EOB, an explanation of benefits. It's definitely really important that you read it and not just assume that you didn't get a bill from Dr. Smith or Jones or your local hospital. And that Medicare covered it, your supplement, your Medicare Advantage, whatever you have, your retirement plan, it all is going to just cover it. You didn't, because with Medicare, they have certain time frames. So if they accidentally billed for something to you and like a couple of years down the road, you particularly need that item and they say, oh, I'm sorry, you already had it. But you're like, no, I didn't. So that's why it's really important that you do review your Medicare summary notice or your EOB from your Medicare Advantage plan. I had a gentleman last week who called from he had got a claim from one of the local hospitals that he owed them over $5,000. And he was covered by the Quimby program that I referred to earlier that paid your premium, the co-pays, co-insurance, and any deductibles. Well, the particular hospital was not aware that co-insurance was a component that was covered by that particular program. So it basically became an education session for them. So it was just a matter of, okay, oops, it was our mistake. We'll take care of that. And now moving forward, the billing department knows that the co-insurance under that Quimby program would be covered. But so it was nothing that needed to cause big alarms, but it was definitely a learning experience for the hospital in regards to what the plan covers and so the individual doesn't have to pay that. So the Office of Inspector General, the OIG, they want to know that kind of information if we are here educating the providers or consumers in the public. So we do a report to let them know that that person saved over $5,000 by educating the local community about the programs. So protect your information. If anyone ever calls you about your Medicare number, ask you your Medicare number, if you are not reaching out to someone, definitely make sure that you don't give them your information unless you absolutely know who that person is. So again, go over your Medicare summary notices and detect any particular problems or concerns that you might have, and report anything. So again, you can either report it to us here at ServiceLink, and we'd be more than happy to do the necessary paperwork that we need to do to report it on. But like I was saying earlier, is that we reported the fact that the hospital didn't know what they were doing, but it wasn't a situation where it was really that. And here in New Hampshire, we don't have a lot of fraud in cases that happen. Primarily, like I said, it was the piece of durable medical. So I'm coming to an end with this presentation. So again, you can contact us at our 800 number at 1-866-634-9412. Or you can go on our website at www.servicelink.nh.org. If you have specific questions about Medicare itself, you would want to contact 1-800-Medicare, because we here at ServiceLink are unable to give you information about if a particular procedure is covered or not. The law prohibits us from telling you that. So you would have to call 1-800-Medicare in general to get that questions answered. If you suspect any type of fraud or abuse and you want to report it, again, you can report it to me here, or you can call the Office of Inspector General on your own at 1-800-447-8477. Are there any questions that anyone has, concerns?
Yes, Michelle, there is one inside the chat.
Okay.
Would you like me to read it to you?
Yeah, I can't see the chat.
Okay. How far before your birthday can you enroll? And when do you receive your Medicare card?
So the general enrollment period, or your initial enrollment period, is 3 months prior to your 65th birthday, the month of, and 3 months after. So if your birthday falls on the second to the end of the month, it would go into effect. So if your birthday was today, your Medicare would have started on April 1st. If your birthday is April 1st, it would have started on March 1st. So 7 months window is what they give you to enroll with your Medicare. Usually, if you enroll within the time period, the 3 months prior to your 65th birthday, or if you're already receiving a Social Security benefit, it happens automatically. So you usually receive the card a couple of months prior to your 65th birthday. So it depends on when you enroll would determine on when your card comes.
Excellent. The follow-up was that the individual had tried to look online for when they would receive the card, but it was asking them for the number on the card. So you can't do that.
No.
You don't have the number.
So yeah, unfortunately, usually if you enrolled today for like May 1st, you would probably get the card before May 1st. Unfortunately, the Social Security Administration, they're not working in the office. There's very minimal individuals that work in the office. Everyone's working from home for the most part.
Mhm.
So the turnaround time is pretty slow. So I definitely always encourage individuals to enroll with the Medicare, if there's that 3 months prior to your 65th birthday, you'll definitely get your card before your 65th birthday.
If you're going online to enroll, is there a special spot to enroll?
Yeah, you would have to go on ssa.gov, and there is a spot on ssa.gov that says under the Medicare tab to enroll with your Medicare benefit.
I don't think I would have put those together, that I would go to Social Security Administration first instead of
Yeah,
straight to Medicare.
Yeah, no, Social Security does the component of the A and the B. They do all the enrollment in A and B. Anything else, so the D, the supplement, the Medicare Advantage, those are done through Medicare itself. Supplements done through your state insurance department, but the D and the Medicare Advantage Part C, those are done through Medicare themselves.
Excellent. I'm just checking in with our participant if she had any other questions or if that helped answer that. But I do want to take the moment to thank you very much, Michelle, for that thorough presentation about Medicare. This program was recorded, and everyone registered will receive a link to the Merrimack Public Library YouTube channel to view at your leisure. We'll put a link in our chat that has feedback about our program today, and if there are any other topics that you'd like the library to cover. And it looks like our participant is good to go. So let me put that in the chat real quick. And of course, I'll include it in the email that everyone will receive after the completion of this. Looks like we are great to go. Thank you again, Michelle, and everyone who joined us today. I hope you have a wonderful day.
Thank you, you as well.
Thanks.